All right, hello everyone, and welcome to today's webinar, the HIPAA Checklist, Simple Steps to Keep Your Office Compliant. My name is Gary Taratsian with the webinar team here at Rectangle Health, and we appreciate you taking the time to join us today as we've got another informative session to help take the stress, frustration, and complexity out of meeting and maintaining compliance. This is a 1 hour course valid for one CE credit. We are a PACE provider for CE through AGD. In order to receive that CE credit, you must attend the entire webinar presentation and participate in the 3 polling questions. Please allow up to 2 weeks to receive those CE credits. They will come via email from me, Gary Taratsian. And then within 24 hours of this webinar, I'll be sending over the recording, links to upcoming no cost CE credit webinars, as well as more details on how your practice can achieve and efficiently maintain compliance, leveraging the right solutions. If you're joining us on mobile, I always say it, the experience is better on desktop and it's easier to reply to the polling questions. If you'd like to take a second to log back in from a computer, you can do that now. And while we wait, this webinar ties in with Rectangle Health's Bridge Compliance Solution. So what is it? It's the tool that helps effortlessly maintain effective and scalable HIPAA and OSHA compliance programs without all the paperwork. Bridge Compliance is innovative and it's easy to use, automating any of those annoying manual tasks to help stay compliant. And if you'd like to receive a personalized demonstration of how the platform works, you can schedule a time with our speaker today using the link that I will drop in the chat as soon as I pass the mic over. And then one more note, as you received emails inviting you to join this webinar, you may have seen a link to complete a HIPAA gap assessment. Our speaker is going to go into it a little bit today, but I see many of you have already completed it, which means you are on your way to addressing the gaps and vulnerabilities in your that could potentially impact your practice's compliance protocol. If you haven't already, I'm going to drop that link in the chat here as well. And I encourage you to take advantage of the tool. It's free to do, takes anywhere from 10 to 15 minutes to complete. A short bit of time to understand where the practice may be at risk. So it's well worth the time. And the best part is the results are straightforward, but you do not have to do the research on next steps, how to tackle the compliance gaps and vulnerabilities. Our host today will walk you through it and show the areas in need of immediate improvement. With that, it's now my great pleasure to introduce our speaker, Shelley Glasson, no stranger to the webinar program here at Rectangle Health. She was with us about 2 months ago, had great reviews, positive response on her presentation, so you're in for a treat here. Shelley's the practice solutions consultant here at Rectangle Health. As I mentioned, you may have seen her in a past webinar. She has an incredibly strong background in HIPAA and OSHA compliance, and has successfully supported a wide range of private small practices to large DSOs and multi-location practices, ensuring compliance education and delivering sort of tailored solutions that meet the practice where they're at. If you have any questions at all during the presentation, please jot them down. I will provide Shelley's email in the chat as well. You can ask those questions directly after the presentation. Shelley, happy Friday. I'm going to zip my mouth up and let you take over.
No worries, Gary. Thank you so much for that introduction. And thank you to all of the attendees that are here to get your CE credit and understand a little bit more about the HIPAA checklist, what's required, what's changing, and different steps you can take to get your practice compliant. So first and foremost, when it comes to, let's see, when it comes to Rectangle Health, we have been around for about 30 years, helping practices with not only compliance solutions, but also other solutions to help you get paid faster, to help with the business side of operating a practice. And we're partnered with all different types of entities nationwide. We're partnered with dental societies, different IT companies, other entities that help support private practices. So we really have your back when it comes to truly understanding the requirements and really the different tasks that need to be completed at the practice when it comes to your compliance as well as other aspects of the business. So our agenda today is to discuss HIPAA, what it is, why it's required. We know it's not fun. We're going to try to make it as fun as possible today. And we'll go over a little checklist that you can learn a couple different tasks that need to be completed in order to stay compliant, and understand all of the regulations that are in place when it comes to HIPAA regulation. So when it comes to protecting your health information or your patient's health information, it applies in the sense that every time that you go to the doctor or to the dentist, you're also hoping and really obviously wanting your data to be protected. You never want any of your information to be stolen from the place that you're going to get care, whether it's for health or for dental. It is truly a nightmare when your identity has been stolen. So us as, the business owners want to make sure that we're doing everything that we can to maintain privacy when it comes to our patients' information, making sure that their information is never leaked from our entity. Because the last thing that you want to do is end up on what I call the HIPAA wall of shame. It is, if you could just Google the HIPAA wall of shame, it's a list of entities on hhs.gov that have reported a breach. You can see that it's happening across all different types of providers, all different range of patients, totally can be anywhere from a small practice that only has 600 patients all the way up to larger entities that have 50,000 patients. So we really want to avoid showing up on that list, and we want to avoid causing any of our patients issues with their identities being stolen. Now, common misconceptions around HIPAA are that, oh yeah, my IT handles it for us, we're good to go. We use a compliant software, so we're protected through that software. I have an insurance policy that protects me, or my office manager handles it for me. Yes, while a lot of these statements are true, there are a lot of other tasks that need to be completed to make sure you are in a compliant state and stay that way moving forward. So the most important thing when it comes to compliance is going to be documentation. Documentation is your best friend when it comes to showing proof of compliance, because if you do ever have an incident or a breach, the first thing that they're going to do is request proof of compliance. So you need to have it written down that, for example, you have policies in place for your practice. They've been customized and they have been updated. You've trained your entire team, they've signed off on the training, and you have a date on that training. You want to make sure you have your business associates agreements. And we'll go over all this in more detail, but I'm just listing out documentation as being one of the most crucial pieces to showing proof of compliance. So when it comes to getting your office compliant, you may have, for example, a loose training schedule. You just kind of train as needed whenever there's been an update or you think that your team is due for an update. You don't really have a HIPAA officer designated, someone that's kind of in charge of making sure that we're handling everything we need to. You haven't completed a risk assessment. These types of things are really important to make sure that you get done at the practice. So PHI, that I kind of went over a little bit before, is just your patient's health information. So protected health information is going to contain all different types of numbers and information that essentially prove the identity of your patient. So you want to make sure that it is protected. Sometimes there's social security numbers in there. Sometimes there's checking account numbers. So super crucial to make sure we're keeping these protected for our patients. Training requirements that are in place. There are 3 different requirements under the law when it comes to annual HIPAA training. Number 1, you need to be able to reproduce the information that you use to train your team. So that means you need to show proof of where you purchased the information or the website that you download the information from. The second requirement is accountability. So essentially making sure that your team was paying attention and understood the information from the trainings you provided. We all know that HIPAA is not exactly the most exciting subject in the world, so we just want to make sure that your team was paying attention and was retaining the information. And then the third requirement, and the most important to protect the business financially, is the employee acknowledgement form. There are two separate forms that need to be signed each time an employee trains, and it needs to be done once a year, every 12 months. So some practices that I've spoken to, they have only trained their employees upon hire, or kind of loosely train them as there are updates, but it is required to train them every 12 months. And I would definitely suggest training them upon hire so that the practice is protected in the event that one of the employees makes a mistake or is the one that causes the breach. The privacy rule in 2025, this is something that is going to pertain to your HIPAA manual. So whether you are obtaining a template-based version or you have downloaded policies, they do need to be customized to your practice, and they need to be updated as time goes on. So definitely make sure that the privacy rule is one of the documents that's in your HIPAA manual. There will be updates to the privacy rule released later this year. Right now, they are still under review, and they will be finalized towards the middle of the year. The security rule is another document that needs to be in your HIPAA manual as well, and customized to the practice and kept updated over time. Just like the security rule, or excuse me, the privacy rule, there will also be updates later this year. They have also not been finalized, but since we are under a new administration and it's a new year, that's something that you need to make sure that you stay on top of and make sure that your documentation matches the most recent change that's been released from Health and Human Services. So the HIPAA binder needs to be customized to the practice, it needs to be updated over time, and it needs to be accessible to every single employee at the practice so that they can always come back to the policy and refer to them to make sure that they are adhering to the laws. And we have come on to our first polling question. I can't hear you, Gary, by the way.
Sorry about that,
Oh,
folks.
no worries.
Polling question number one should be up on your screen. How often does your practice provide HIPAA training for staff? Annually, only during onboarding to new hires. We don't provide HIPAA training. Hope that's not the answer. Quarterly or every 6 months. Give it another second here, Shelly. And folks, while you answer those, I've dropped a bunch of links and information in the chat. Shelly's contact information for any questions or further discussion, link to the HIPAA gap assessment, as well as a link to register for our next HIPAA training. And with that, I am going to end the poll and share. Looks like everyone, well, a majority, 84% said annually, Shelly.
Perfect. So it sounds like you guys are, due diligent in your training schedule. So that's great to hear. Very refreshing. Now, the next thing that we'll go over is going to be the breach notification law. So in the event that the practice did have a breach at the practice, there are breach notification laws that are in place. The first thing that you're required to do is hire on a forensic investigation team to essentially figure out how the breach happened. Starting cost of an investigation is anywhere from $50,000 to $100,000, and it may also involve shutting the practice doors for a few days and turning patients away as you try to figure out how the breach happened. The second thing that you're required to do is notify patients that have been affected by the breach via first-class mail. You're also required to notify Health and Human Services, post it on your website, and sometimes you're required to set up a call center for a minimum of 90 days to provide a number where patients can call into and learn more about the breach and how their information was affected. Now, this is a huge laundry list of tasks to be completed in the event that you do experience a breach. So we are here to help you, and we'll go over that at the end. But again, you want to avoid all of these penalties that you see here from HIPAA violations. So one single violation, the penalty can range anywhere from $10,000 all the way to $1.5 million, which is completely outrageous. It can be extremely detrimental to a business, and it can also be completely avoided simply by becoming compliant. Now, the next thing we'll go over is business associate agreements. These are a really cool part of the law and are part of the documentation that you want to have in place in order to show proof of compliance, because you may not actually experience a breach, but one of your third-party vendors that you work with may experience a breach. So the way that a business associate agreement works is you need to be the person sending the agreement to the third-party vendor to sign, and then you store it securely at your practice. Now, there's a common misconception with these agreements. A lot of clients that I speak to will say, oh yeah, I've signed this agreement with X, Y, and Z company, I'm good to go. But the document protects the sender of the agreement. So the document that you signed actually protects the entity that sent it to you. So you want to make sure that you're the one sending it out. It is an agreement that essentially states that you have done your due diligence in protecting the PHI of your patients. Once it leaves your practice and it is now in the hands of the third-party vendor that you're working with, if they experience a breach, it is not your fault and you are indemnified from any financial responsibilities. So certain examples of a business associate would include any data analytics companies that you're working with, if you have an accountant or a bookkeeper, if you utilize an appointment setting company to remind patients about their upcoming appointments, those are all considered business associates. So essentially any vendors that you're sharing patient data with need to have an agreement in place. These also get updated every 1 to 3 years. They're not really on a set schedule the way that policies are, where there are annual updates to policies in your HIPAA manual. So you want to make sure that you consistently have the most updated version in place with each of your vendors to indemnify your financial responsibility if something did happen. You want to make sure you're covering all of your bases. Yes, so it must be in writing, as we are tying back into documentation being super important to being able to show proof of compliance, and it protects the sender of the agreement. Now, I'm sure you have seen in the news a lot of different HIPAA settlements for entities that have experienced breaches and have then had to pay those fines. So this ties back into why we need to become compliant in the first place to avoid any types of fines like we see in the news. And we are at our polling question number 2.
All right, coming right up. Let's see. Does your practice complete annual HIPAA risk assessments? We'll give everybody a second here. And again, folks, just a reminder, multiple links in the chat, visible to everybody. Hopefully, if it's not, shoot us an email. But the gap assessment, upcoming CE training, as well as a link to, schedule time at your convenience with Shelly to discuss your HIPAA compliance, your OSHA compliance needs at your practice. Shelly will tailor that conversation specifically to you and your needs. So great opportunity to connect with the expert in the field. And I'm going to wrap this polling question up and share the results. Looks like 68% said yes, 9%, so 6 of you said no, and 24% not sure. All right,
Okay,
Shelley,
well,
back.
good to know. So the risk assessment is something that ties into, again, your documentation. It is something that is required to be completed annually, and it is a questionnaire asking you about the practice's compliance status. So it will ask you about different tasks that you're completing in order to remain compliant. At the end of the risk assessment, it will give you a score on how well the practice performed, just so you have an idea of the vulnerability level or areas that may be of concern. And then from there, after completing an assessment, which you can do with Rectangle Health, the second part of the requirement is to meet with someone to understand the results that you received on the assessment and then understand the requirements that are in place so that the next time you take a risk assessment, you can answer that you are, completing those requirements and that you can score a bit higher. So, risk assessment is definitely part of the documentation piece of becoming compliant and staying compliant over time, since it is annually required to be completed. Now, ever since, let's see, we'll go forward. Okay. Now, another big one to talk about is your cybersecurity. So as we know, most of our operations are on a computer. We also have apps on our phone. During COVID, a lot of people were working from home and signing on to their computers remotely, working remotely. So cyber breaches since 2020 have definitely increased because when information that the practice holds per patient is resold on the dark web, it's worth about $1,000 a piece. So if you multiply the amount of patients that your database currently holds by $1,000, you can see why a practice is a target for a hacker or someone who is able to cyber hack entities because when they resell the data on the dark web, they have a pretty big payday. So making sure that you are compliant from the technical sides of the requirement are something that your IT provider should be doing for you. We are here to help on the administrative sides of the requirements, but I would definitely consult with an IT provider if you're not already working with one. It's very likely that they have you compliant from all the technical sides of the requirements with your firewalls and making sure that your IP address is secure. But I would definitely have a conversation with an IT provider. And if you don't have one, I'm happy to introduce you to some to make sure that you feel comfortable with anything that you're doing being protected on your computers, phones, internet, everything that's involved with electronics. Now, if you are utilizing emails to communicate with third-party vendors or with patients, it's very important that you do have email encryption. So that is essentially when you are sending EPHI, the recipient of the email will have to create a password in order to view the email. And they'll continue to have to enter in that password in order to view that protected email. Emails is one of the most common ways that we see breaches. And sometimes patient information is sent to the wrong recipient as well. So that's a very common one. I had a practice that I was working with 2 years ago that actually experienced an email breach, and they just received the notification that the investigation was finished and they were fined $200,000. So again, easily avoidable, that fine. Just making sure that you are protecting your emails. They are not necessarily compliant under HIPAA regulation. And if you have questions about that, I am happy to assist. Now, phishing is another common way that we see hackers getting into your systems. So it's something to be aware of. I'm sure that you've seen it at your practice already with different emails like the one that you're seeing here. This looks like it's one from PayPal asking you to view and pay an invoice. So if you have any questions about emails that may be trying to hack into your information, I'm here to help as well. We've also been seeing a huge rise in phishing via text message. I'm sure you've seen it on your personal cell phone, receiving messages from strange entities asking you to pay an invoice, or if you don't click here now to pay the invoice, your X, Y, and Z service will be shut off. Again, here just be very aware. I definitely wouldn't click on any links, especially when you're inside the practice walls, because from there the hacker can access through the internet, they can access your systems. So ransomware is something to be aware of as well. So once the hacker is in your system, what they can do is have a hold on your information, and they won't give you access back to the computer unless you pay a ransom. A lot of the times the ransom is in like a cyber coin. So like any of the cyber types of money that we're seeing these days that I won't mention. But you're able to, they'll be asking for payment that way. And until you pay them that amount, they won't give you your access back to your computers. So the cost of ransomware has increased since 2020 as well. A ransomware attack really affects the business. Again, if you're shutting down the practice to conduct a forensic investigation, the starting cost of that investigation is huge. So you really want to make sure that your practice is protected. Now, HIPAA is not just a one size fits all. So it's super important that your practice is taking all of the steps to make sure that you are in a compliant state and staying in a compliant state over time. This pinwheel is a really great visual representation of how the practice can get protected. Um, if you are processing credit card payments at the practice as well, super important to make sure you are PCI compliant. In order to get there, you will have to complete an annual SAQ and run quarterly vulnerability scans on your IP address. If you have questions about that or being able to spot different PCI costs that you're seeing on your merchant processing statement, I can help with that as well. But making sure that you are PCI compliant is a super important way to protect credit card numbers. And we are at our third polling question.
Your way. How does your practice communicate with patients about their health information? Is it through the patient portal, encrypted emails, non-encrypted emails, or by text, phone calls only? We'll give everyone a chance to answer here. Looks like we got a range of results. I don't want to convince anyone to not answer truthfully, but those non-encrypted emails are by text. Non-secure, non-HIPAA compliant text is scary, folks. So, and we'll give it another second here. Results still pouring in. All right. Share these results. 48% through our patient portal, 9% encrypted emails, 3% non-encrypted emails or by text. Again, scary. Phone calls only. Shelley?
Okay, wide range of answers there. Yeah, so
For sure.
utilizing your EHR system or portal to communicate with patients is definitely the most compliant way to communicate with patients because it does require them to log in. A lot of times too, those portals, they do have like a multi-factor authentication where the patient has to enter in a code from their cell phone to confirm that they really are the person that should be viewing that information. Phone calls are great as well, but I would err on the side of caution if you are utilizing emails that are not encrypted or if you're texting with your patients because iMessage is not an encrypted service and data can still be leaked that way. So definitely suggest using your patient portal or your EHR portal to communicate with patients or encrypted emails. Now, when it comes to documentation, it is also super important that you have your contingency plans in place. So this ties back to when we went over, yes, your IT provider is doing everything that they can from their end and the technical sides of the requirements to keep the practice protected. But you do also need to have proof of compliance and be able to show those documents that you've written down, your data backup plan, that you have a recovery plan, and you have an emergency and incident response plan. So your IT person will handle the technical, and then administratively, you need to make sure that you have these plans in place that essentially detail how your IT provider is going to have your back and keep you protected when you're handling PHI. So making sure that you are completing your annual risk assessment, updating and customizing all of your HIPAA documentation, updating and customizing all of your contingency plans. So your emergency plans, your response plans, And then also having your training documented as well is how you will stay compliant from the written side of the requirements. So these next slides pertain to the plans for data backup. So your IT person is probably going to have you protected when it comes to your data backup. It is required under HIPAA regulation that you are backing up in a cloud-based solution using at least 256-bit encryption. So super important, maybe get in touch with your IT provider and ask them, hey, how is our data being backed up? Because I saw in a webinar that it's required to be in a cloud-based solution using 256-bit encryption. And they'll be like, oh my gosh, wow, this girl knows, or this guy or girl knows what she's talking about. So you want to make sure it is in a cloud-based solution. We do see a lot of theft of physical servers because hackers can access those as well. And then hard drives and actual computers have been stolen as well. So that's why the requirement is now a cloud-based solution. You also want to make sure that you do have plans for incident response. So in the event that you do experience a breach, you know, who's the first person that you contact, who's in charge of compliance at the practice, and making sure that someone can step in and respond, as well as your IT provider, you know, come in and remove a virus if it's been attacking your computers, or if you have a ransomware attack, come in and be able to reinstate your information and have access to your EHR or EMR system. So these are 10 different tips to protect your practice, and we'll go through like the HIPAA checklist. First and foremost, updating your HIPAA plans, policies, and procedures, making sure they're customized and updated over time. Be aware that the changes to the privacy rule and the security rule will be instated later this year, as they are currently under review. You need to keep a document of how PHI is accessed at the practice and how it is secured. So this is pertaining to those data backup plans, those incident response plans, those emergency plans. Make sure you have a business associate agreement in place with each vendor that you're working with that has access to ePHI. So again, certain examples are your IT provider, if you utilize an appointment setting company, if you have an accountant or a consultant or a bookkeeper. So making sure that those are being sent out, signed, and stored securely at your practice, and then updated every 1 to 3 years on schedule with when Health and Human Services releases the updates. Document your HIPAA compliance progress. So complete that annual HIPAA risk assessment that's required to be on file each year. Make sure that you're getting patient authorization when you are sharing their information. So this is typically your privacy documents that are in those packets for new patients, as they sign off on letting you access their information and share it to pertinent entities depending on their care. Train your employees annually. Make sure that they're aware of what phishing means and how important it is that they stay on top of recognizing when an email is a phishing email or a text is a smishing text trying to access your practice's information. You want to be more proactive than reactive when it comes to your HIPAA compliance. So making sure that all of these are in place so that in the event that something does happen, you can show proof of compliance and you're not scrambling to make sure that you have all of your compliance requirements in place. It's kind of similar to when you're driving your car and you don't have insurance, right? So you can definitely drive a car without having car insurance. Is it recommended? No, because if you experience an accident, then you are not going to have a great time going through all of those financial difficulties, getting everything taken care of, and potentially paying for other damages. So same thing with your practice. You don't really want to be non-compliant or in a state where you're vulnerable to any of those penalties that we went over before, and make sure that you're being proactive rather than reactive. Cyber insurance is recommended as well, just to protect the practice. A lot of the malpractice insurance and business insurance will cover this. So contact your insurance provider and see if they do offer cyber insurance options to make sure that you're not financially liable in the event that something does happen. Regularly review training. Earlier, we went over the 3 requirements for HIPAA training. Number 1, being able to reproduce your content. Number 2, accountability. So making sure your team understood the information by completing quizzes. And then number 3, the employee acknowledgement forms, making sure that the employee is signing them and that they understand their responsibilities under the law. Delegating the task of compliance is super important, especially as a business owner. So very important to either explore options to get some assistance with your HIPAA compliance. Definitely would recommend assigning a compliance officer at the practice. It's not necessarily always the office manager, it could also be the bookkeeper. Sometimes it's the business owner. But delegating the task of compliance is definitely going to take the headache out of making sure your practice stays compliant over time. And we are at the end.
So thanks so much, Shelley, for a great presentation, folks. That concludes the CE portion of the webinar today. Just a few housekeeping items, reminders before I pass the mic back to Shelley. CE credits will be emailed to you within 2 weeks of today. So be on the lookout for those. Give us 2 weeks as we have a lot of them to process. When this webinar ends, you will be prompted to complete a survey. Please take a few minutes to share your feedback on the presentation, how Shelley did, how I did. Every response is closely reviewed. We take it to heart. We just want to enhance the webinar experience for you and make sure we're providing the right type of content that you're looking for. And a reminder, complete those HIPAA gap assessments if you haven't already. The link is in the chat. And if you'd like to just skip that step and just speak to Shelley directly about your compliance options and how she's helping practices simplify and maintain that compliance headache free, that link is also in the chat. Before we wrap up again, just going to take a few minutes here back to Shelley to do a really quick overview of bridge compliance.
Thanks, Gary. Yeah, so as I
Yeah.
mentioned at the end of the webinar, super helpful to delegate the task of compliance to someone else. We offer a solution here at Rectangle Health called Bridge Compliance that can essentially delegate the entire task of compliance to us through an automated system. It is a solution that has helped thousands of practices, small and large, get their practice in a compliant state and stay compliant over time. It's an online portal that each employee has access to. We handle all of your customized documentation. We have an in-house team of attorneys that actually goes through and customizes each practice or each policy to your practice. We keep them updated for you over time as well. So anytime Health and Human Services releases an update, we actually go in and make the change for you. We also provide you with all of your customized and updated over time business associate agreements that are written by our in-house legal counsel. We give you your annual risk assessment, your emergency and incident response plans, all of your annually required training. We handle your PCI compliance, can offer you data backup, email encryption, and then we can also help with reporting an incident and all of your incident response. So I mentioned earlier in the webinar that that is probably one of the scariest parts of experiencing a breach or an incident is figuring out everything you have to do under the law to report the incident and notify patients, hiring on forensic investigators. We have a team of incident responders that is made up of HIPAA attorneys, breach coaches, and forensic investigators that actually step in on your behalf to handle the breach. So super important and something to consider if you are looking for assistance or wanting to delegate the task of compliance to someone else, because like we mentioned earlier, HIPAA is not exactly the most exciting subject in the world. So being able to delegate it to a third party can be what protects you from those penalties that we mentioned earlier.
All right, Shelley, thank you again so much. for taking the time to host this webinar, go through the great training. Um, Folks, one final time, 2 weeks until you receive your CE credits via email. They will come from me, my email address. Um, Please do reach out to webinar@rectanglehealth.com. If you do not receive them within 2 weeks, I'll be happily, I'll take a look and make sure to get that certificate out to you ASAP in case there's any issues. Again, the end of the webinar survey, please let us know how we did today. And if bridge compliance seemed like it sparked some interest, if you'd like to schedule some time, Shelly, again, that link is in the chat and it'll be in the follow-up emails alongside the recording and some details on upcoming CE credit webinars. Thank you once again for joining us. We'll give you about 15 minutes back in your day. Enjoy the rest of it and have a great weekend ahead, everybody. Thanks again.
Thanks, everyone.